This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hi, this is Kelsey Podnix. I'm the program coordinator at Tower Health. We're having some technical difficulties, but I can talk while our two residents try to figure that out.
Sure, I think that would work for us.
Okay.
Yeah, however you want to proceed.
Yeah, so I'll just, I have the PowerPoint. I can't pull it up of how I have it pulled up now, but I'll just run off some things from the PowerPoint. And if they don't get to during our time frame, I'll leave their contact information in the chat so everyone can feel free to reach out to them with more questions. So anyway, so we're Tower Health. We're in Wyomissing, Pennsylvania, about an hour outside of Philly, about an hour and 20 minutes from Baltimore. We're a standalone rehabilitation center, 111 beds, 61 acute beds, 11 secured brain injury beds, and 50 subacute beds. Our program is 16 residents for each year. 2 years ago, we became a 4-year program. We are initially accredited for 3 years, but we became a 4-year program 2 years ago. Just going through here. So your first year as a resident will be at the Reading Hospital, which is a 700-bed hospital, is the largest emergency department in Pennsylvania, the 10th busiest emergency department in the United States, and a level 1 trauma center. There's, like I said, there's over 700 beds, over 70 ICU beds, and has a really rich history of GME experience. The IM department is over 50 years of teaching services. Sorry, I'm just trying to slide through. So our schedule, I'm not going to go through the schedule as much. I don't want to waste too much time, but PGY2s, it's mostly inpatient with 4 months of outpatient services. PGY3 is 3 months of inpatient brain injury, a month of elective, 2 months EMG, a month of sports med, pain, MSK outpatient neurology. PGY4 is when we do our peds. Our pediatric rotation is at Good Shepherd in Allentown, about an hour away. And you do outpatient and EMG during that month as well. Let's see here. So we also have a brand new teaching college with us. It's not a new college by any means, but it's a new campus, Drexel. So with Drexel, we have brand new simulated patient rooms, a brand new anatomy, cadaver labs, and that's all within 5 minutes of our rehab hospital in West Reading. So the PGY 1 year, you do 3 months of medicine, 1 month of trauma, 1 month of peds, 1 month of neurology, emergency medicine, pulmonary critical care. You're with us for a month at PM&R, a half block of orthopedic surgery, a half block of neurosurgery, and some other sprinkled in there like a half or 2 weeks of palliative medicine. The benefits, I can send this PowerPoint out. I don't know if there's a Google Doc like there was in previous years. We recently increased our resident salaries from last year. So just to give some ballpark figures, PGY1s are 63,000, PGY2s are at 64, PGY3s are at 67, and at a PGY4, it's 69,000. As a PGY1, you get $1,000 in CME funds. At a PGY2 and up, you get $2,000, and that, I'm sorry, this is per academic year in CME funds. We also pay for your memberships for AAP, PM&R, and AANEM. Yep. Let's see here. And the program also gives you 5 CME days per academic year. We do a lot of, for those interested in sports medicine, through Drexel and through local hockey teams and through Reading Hospital, there's sideline work you can do. We have the Reading Hospital Road Run, which people do sideline work through. We have a unique gym locally that caters to individuals with certain disabilities called I Am Able. So we're working on potentially doing an adaptive clinic there. Let's see here. And then living in Berks County, there's a lot to do, a lot of local restaurants, a lot of farmers markets. We have a lot of street fairs, and it's really, you get the best of both worlds. It's a downtown feel, but if you like the outdoors, we're very close to nature and everything. And we're really close to big cities. Like I said, Philly's about an hour away from us. Baltimore's close by. New York City's close by. We have the train station that will take you to anywhere you want, and close to airports. And I kind of zoomed through that because I didn't know how much time we had. So if anyone has questions, I'm happy to take them. Again, I'm happy to also put the residents' emails in the chat. So feel free to reach out to them because they will really know everything.
We have 10 minutes, by the way.
Oh gosh, I really zoomed through that. I got nervous that we waited too long.
No worries.
I'm going to see if the residents are still trying to get in.
I may have missed this. Are you guys a categorical program or advanced?
We are a 4-year program. So we initially were accredited as a 3-year program. Last year, we became a 4-year program. So Mike, who was our Dr. Jajusik, who was supposed to be on this call, was one of our first categorical residents. And then this year we have our second class of categorical residents. So we have 4 residents each year.
Thank you. Can you talk a little bit about didactics and what the schedule looks like for that?
Yeah, so didactics are on a Wednesday afternoon. It's protected time. It's every Wednesday from 11 to 4. And that's pagers off. No one's bugging anyone. Totally protected time.
Are there like noon conferences at all as well?
Yep, we have grand rounds that we're incorporating. We have outside speakers come, and we have speakers internally too from different departments come for those that we invite.
Are those also required, or is it kind of like, you have to make 80% of those or something like that?
Um, can you rephrase that?
So sorry, yeah. Are those noon conferences required? Or
Yeah, those are required.
I've heard that
But we have grand rounds, yeah, that we want them to, when we want our residents to go to those.
okay, gotcha.
Yeah, unless they're on like an away rotation, or if they're up on their pediatric rotation, or of course, if they're a PGY1, they're at the main or we all call it the main hospital. But when they're on, when you're a PGY1 resident, you're doing your didactics with the service that you're rotating with. So that'll be, your internal medicine, you're at those didactics.
We're still pretty good on time. Folks, if you have any questions, we have about 6-7 minutes, so please feel free to ask.
And just to mention, for your PGY1 year, it's really, you're learning about medicine and everything, but they have it geared towards PM&R. So for instance, when you're in trauma, it's geared towards patients that you will be seeing at the rehab. So we really thought of each service and what you'll be trickling down to the rehab. So we really geared it towards that. And it's nice because all those people that you'll meet during your PGY1 year, you'll be seeing, throughout your services in PM&R.
We have a couple of questions in the chat. Is there any way to directly contact you all at Tower Health?
Yeah, I'll be putting Dr. Lopez and Dr. Juskek's email in the chat. So yeah, so you guys can reach out to the residents directly. They were supposed to be on this call, but technology didn't help. Are there online didactic sessions where med students can join for your program? That's a great question. That's something we looked at in the past. I can talk to Dr. Parkesh, who's our academic chief resident, about maybe doing some sessions, because that's been something med students generally have been interested in. So we can look into that. We have an Instagram page, Tower Health PM&R. So if we would do that, if you follow that, that's where we would put that information. How are calls, i.e. home calls, night float? How do residents do in terms of fellowship? Do you take IMGs? So I'll start from the bottom. Do we take IMGs? Yes, we take J1 and H1Bs. How do you do in terms of fellowship placement? So we haven't graduated anyone yet. We're a fairly new program. We have our first class graduating this year. Not to spoil anything, but someone has already matched into a fellowship. So that sounds really good. But we haven't had anyone else graduate yet. How are the calls, i.e. home calls, night float? So during your PGY1 year, when you're on internal medicine, which is 3 months, you do night float. It's a week, it's one straight week of night float. Other than that, all of your rotations, other than your 1 month of emergency medicine, are all Monday through Friday. I'm sorry, let me rephrase that. Internal medicine, your 3 months of internal medicine you can work weekends, but you don't have home call. You do have 1 week of night float during that time. Your emergency medicine rotation, you can work weekends. All other rotations during your PGY 1 year are Monday through Friday. So that's that. And I'm just trying to catch up. And home call. So PGY 2 through PGY 4 year, we're starting to do an at-home call. So that's Monday through the next following Monday. And this is subject to change. So we'll see, what the residents like and dislike, but starts at 7 p.m. and ends the next day at 7 a.m. And they have it for the whole week. So there is no in-house call when you're on your PM&R, your PGY 2 through 4. I think I answered those questions. I'm going to type their email addresses in the chat here. Well, thanks everyone for working with us during these technical issues. Anyone have any other questions, send them to Mike or Kevin. We'd be happy to talk to everyone. And follow us on Instagram so we can, if we have any updates, they'll be there.
Thank you. Very quickly, did you happen to put those emails in the chat?
I did. I just sent them.
Oh, okay. I'm not seeing it on my end. I don't know.
Oh, I don't know what I'm logged in under, to be honest.
Oh, no worries. Let's see. Wonder if there's another way to kind of disseminate.
Yeah.
We still have the remainder of the session, but if you're able to kind of
I think I just sent it to the host. Let me I'll redo it. Oh, it looks like the host sent it to everyone. Okay.
Perfect. All righty. Well, thank you so much for your time. Truly appreciate it.
You're welcome. Thank you, everyone.